This is an ECG of a 51-year-old woman who was seen in follow-up in the cardiac clinic 4 years after a successful repair of an atrial septal defect. Let's look at her ECG. Looking at the long rhythm strips, we can see that there is a P wave before every single QRS complex. Are the P waves from the sinus node? No, they are not. The P waves are negative in the inferior leads. This means that they are coming from the inferior part of the right atrium. This explains why the P waves are positive in the superior leads. The atrial activation is perpendicular to lead 1. That is why the P waves are flat in this lead. This is called an ectopic atrial rhythm at about 75 beats per minute. The PR interval is normal. The QRS axis is positive in lead 1 and positive in AVF, suggesting a leftward inferior axis, which is normal. The QRS duration is prolonged, about 100 milliseconds, with an RSR prime pattern in lead V1, and a slurred S wave in lead 1 and in lead V6 of about 40 milliseconds in duration. This favors a pattern of an incomplete right bundle branch block pattern. With right bundle branch block, we can still use the ECG to assess for the presence of hypertrophy or infarction. Here we see that there are no voltage criteria for either right or left ventricular hypertrophy, and there are no abnormal Q waves, so no evidence of infarction. We can see that the ST segments are all normal, and the T waves are positive in lead 1, AVF, and V2 to V6, showing a normal pattern of repolarization. Overall, this ECG shows an ectopic atrial rhythm at 75 beats per minute with an incomplete right bundle branch block pattern of conduction.